So this is Steve Zeltzer with WorkWeek, and today we're going to be discussing the issues facing frontline workers, African-American workers, and workers in the city and county of San Francisco and in San Francisco who face a very dangerous and very potentially deadly situation as far as contamination by COVID-19 and the critical issue of their health and safety of themselves, of the clients, of the people who need services, and the public. So thanks for joining us on WorkWeek. And maybe when people speak to a question, I'll introduce the question. They can introduce themselves, and then we can have some comments on the question.
Oh, Brenda.
Oh, go ahead, Brenda.
Oh, Brenda Barrows from San Francisco. I'm the president out there for 1021.
Nicole Chris, SEIU Dental Line.
Shema, Supervisor, District 10.
Ken Cox, SFMT Shop Stewart, former Director of Project.
Cheryl Thornton, I'm the Vice President of the Community Chapter for SEIU 10-1, Shop Stewart, and co-founder of Black Workers Unite.
John Econ George, President, Tri-City NACP, that's Fairfield, Sicily, and Vacaville.
Ingrid Cobb, San Francisco General Hospital, Shop Stewart.
My name is Thornton, and the reason that Kim and we kind of put this town hall together is because of the impact of COVID that we're witnessing in the there was already disparities in many of our departments. We saw that through the workforce data that was put out recently. We were going to be having a hearing that was going to be sponsored by Supervisor Shaman Walton, but due to the pandemic outbreak, it has been postponed until further notice. But we wanted to still keep in the forefront about the disparities that we're seeing with our residents in San Francisco as far as around testing and not having access to testing and unsafe working conditions and the impact that we're seeing disparities on essential workers. And we also are here to talk about that we're going to a protest a car protest May Day starting at 3rd Baptist 1399 the City Hall to the to Howard. But we'll talk about the flyer up for the protest. So would you like to say something?
No, I just want to say hello everyone, and I mimic Cheryl had stated. It seems like there's views even in my there's a lot of going on with the PP. People do not have the proper tool they need. So we ensure that everyone has the proper gloves out here. These buses cleaning up and protecting themselves, basically.
So Supervisor Walton, we would, since you are a supervisor on the phone, we would like to have a dialogue with you today about how you see that you'll help us with some of these disputes around unsafe conditions with around workers and so forth.
Thank you, Cheryl and Kim, and thank you for setting this up. One of that, I know it's not to anybody on this phone that the disparities that exist, zip codes here in San Francisco, also correlate the workers are not necessarily receiving the proper protection and gear. So if you look at codes that are affected, they're here in the sector here in District 10, 107, 124, and one is the mission, but it also District 10 to a degree. These are the areas where we haven't seen level of opportunity in terms of having the right gear and And it's the same thing that's in for some of our front workers here in San Francisco. So whether it's MTA, whether our frontline workers who work at hospitals, whether it's our grocery store clerks and folks who contact with the public on basis, a lack of equipment. One of the things this has been doing, particularly more recently, once we finally was able to get the Department of Public Release data by race, zip code, which took me weeks to finally step up in the number of contracted cases as well as the number of deaths. Every Black death that has died as a result of COVID-19 in San Francisco has been a district. So we immediately called for of Black community leaders, Black community-based organizations to come together. And we also went to the Southeast Health Center on last week to make six demands. One of them is pop-up testing, and that's asymptomatic pop-up testing for everyone in the zip codes and in the district and in the areas where we see the most number of COVID cases. Also goes for line workers who work, live, and spend time in communities as well. We're also asking for more field care clinic sites so that we can have a place where we can do urgent care, provide more testing, all the zip codes and all the areas. We see the biggest disparity when it comes to COVID cases here in Cisco. We've made things, we're asking for protective equipment for everyone who lives, resides, and works in communities as well. We're also asking for the, I'm sorry, I'm just looking at my list real quick. We're also asking immediate testing for home relation and setting, which as we know is disproportionately people of color, and we're trying to get of our homeless folks that live in counties that are more susceptible, more likely to the virus, placed in hotels. So I just want you, one, in terms of what we can do, 6 demands that we've made to the Department of Public Health. I was having a text conversation with OFAX. Yes, they still have not responded to those demands. I am doing a resolution Tuesday's board meeting calling for these 6 to be met, which also includes make proper protective equipment for frontline workers, Black workers, for workers isolated and disenfranchised communities, and to continue to push Department of Public Health and the rest of the leadership starts to care about seeing evidence, leadership, particularly Department of Public Health, show concern for Black folks and community, but also Black folks and others. Right now, Burndy, we put a together from local to get. We're trying 2,000 masks donated us here in San Francisco, and to make sure that we give the mask our frontline healthcare workers, our firefighters, and I'm waiting on more information as to when that will buy, if we make that come to fruition. Hopefully, if we do, by at the latter part of next week, and get out in the community to disseminate these masks to frontline workers, our fire, and our police department. And as Cheryl knows, to this crisis, we another for us to talk about Black workers, how the lack of promotion who are most likely to be disciplined, ones who are not hired adequately, and all of the issues that we have there, and resolutions that I'm going to be working on. Some of some authority that of human resources has to get it into departments like Human Rights Commission, to mandate for so that we can have independent oversight of how our workers are treated, but also very aggressive steps in making sure things that have happened in the past have happened again. Want to do it on the mayor's demands and address what has happened with Black workers. Look at, demonstrate real ways to fix that. We want to possibly shift the equal employment opportunity office from DHR into other city departments. So there's some things we want to tangibly do. It will have to happen by legislation, but there are steps we want when we come out of this crisis to make sure that our Black workers are treated equitably, move forward. And so we'll be together to do that.
Okay, thank you. I think Kim Lynch had a question, Supervisor, about telecommuting. Because there's a disparity. The mayor advised the department to relax the rules around commuting, especially with people with health conditions. And I think Lynch, who works at Commonwealth Center in the Department of Public Health, wants to mention something about that.
Yeah.
Thank you.
Hi, Shamon, can you hear me? Hello?
Yeah, we can.
Can you hear me?
Yeah,
Hi, the question I wanted to ask Shamon was, I'm a health worker 3 and I work at Tom Waddell Health Center. I was denied twice by the city to work from home, which I can work from home because I'm a case manager, substance abuse. I deal with the homeless, marginally Black males, that we deal with, as you know, at Tom Waddell. I don't know why the reason I was denied twice from the city from not working from home. My job is easily could be work from home with a laptop and making telephone encounters, which I'm doing now inside the office. What I'm seeing is they're putting a lot of Black and brown workers on the forefront and letting other workers work from home, and it's not fair. I'm seeing a lot of that too with the telecommuting part of the aspect of this pandemic.
So in terms of your specific case, and I know I've had conversations with other employees with the city that share some of the same concerns. Obviously, there's levels of people who are deemed more susceptible to attract the virus. And so there's a hierarchy in terms of making sure that people who are over a certain age don't have to go into work, making sure people who have certain underlying health conditions don't have to go into work. I know we've also put some things in place in terms of people being able to borrow sick time, people being able to do things to where if they absolutely can't go to work because they are more susceptible or have been in contact with someone who may have contracted the virus, we've tried to make allowances for providing the opportunity to stay home. It's not ideal for people to want to borrow from a sick bank. It's not ideal for people to be using sick time or even vacation time just to stay safe. And we're definitely aware of that and understand that dynamic. We've also just been trying to respond to this crisis and this emergency and allow people to try to be flexible and try to be creative and innovative about how people can stay home and not have to go to work. One of the things I would say, and I'm not sure in terms of what the union leadership has done to support your particular case or some of the similar cases that we see, but I would recommend getting together with the leadership of every particular union, particularly unions in healthcare, and coming to city leadership and making sure that not only my office and my colleagues are aware, the mayor's office is aware, and I'm pretty sure you've done this to some degree and some level, but we are trying to get department heads and department leadership to, of course, do a better job of allowing people to telecommute and make sure people don't have to be on the front lines, particularly to point essential workers that have to, that are not required to move around 24/7 during their job. And you can do things either at home or from a desk. And so we're working on it. I think there's been some changes, but we have a long way to go to provide the right opportunity for everyone to be able to shelter in place safely and telecommute if they have a job that really allows for that. And, you know, just from a personal level, I won't go into exactly where, but my wife works for the Department of Public Health. She's an RN. She's on the call center and still having to go into work. And you know, she's been having conversations about why they can't answer calls and provide advice from the nurse advice line from homes, except. And so this fight is happening everywhere. You know, I know technology is involved to some degree and some level, which everything continues to be excused though as time goes by.
Right.
And so we're working to push the departments to do a better job in providing these opportunities. So you're not fighting alone. I have a specific answer in terms of if we're going to be able to make this happen by next week, but some of it is changing and people are pushing and fighting for that ability.
Thank you.
Okay, question
Okay.
two.
One of the
Thank you, Supervisor Walton.
one of the issues is Cal-OSHA, and I understand there have been no inspections by Cal-OSHA of whether or not workers have been getting their PPE in the city and county of San Francisco. And that, I think it would be, and that's they have to investigate and they have to take action to demand that the employers provide PPE and proper training before they're put in dangerous situations. And I think that there's been a major failure. There are less than 200 inspectors and only one doctor and one nurse of Cal-OSHA in California. So one thing that might be useful, Supervisor, if you send a letter to Cal-OSHA, a public letter calling on them to start investigating if workers are being properly protected in the city and county of San Francisco. And also against retaliation. It's illegal to retaliate against a worker who makes health and safety complaints, who says that they're concerned about their health and safety and being protected. If they're retaliated against, that is improper, illegal. And I know Cheryl has filed some complaints. I don't think there's been a physical investigation, but I think they need to do that.
Right.
And we need to demand that Governor Newsom hire more inspectors, hire more people to do this inspection. You know, we're not trained to know what all the requirements are, but there are people that are. Anyway, that's it. Why don't we go?
It would also be great to see an email to or some of the comments that has been made to Cal-OSHA from some of the workers as we prepare to reach out to Cal-OSHA.
So
Yeah,
Supervisor Walton. Okay, go ahead, Brenda.
So my question is, and mine is a little bit different than some of the other questions. So my issue is that before COVID, it's been documented that there are all these healthcare disparities among African American patients. And so I want to know, is anybody looking at that still and making sure that that doesn't play a role in how people are treated about COVID?
Right.
i.e., it's
Very
who gets
important.
it, what people are admitted to the hospital.
Right.
I mean, the kind of data needs to be collected as we go through this process.
Right.
But we're definitely paying attention to it, and of course reaching out for you know, we've been pushing on the health disparities that exist in this for decades, and continue to monitor all of the data in terms of health disparities that affect our people. I think one thing that is very clear, to your point, is that the Department of Public Health leadership was not proactive in doing everything that it could to make sure that our communities of color that typically have to do with the most negative impacts of any health disparity, they didn't do a good job of working to prevent that. And even with the new data and information we have, they still haven't taken the drastic steps to be proactive about stopping certain populations from contracting the virus and stopping certain populations from being able to spread the virus. We know that people of color, Black people, Latino people, Asians are contracting the virus at higher rates here in the city. We know that the zip codes here in the Southeast sector have the highest number of cases, but yet we still have asymptomatic testing in these areas and communities. So find out who may test positive, who may have contracted the virus, so they shelter in place safely and be away from people and stop that. So to your point, we're monitoring and we're always focused on making sure that we address these health disparities that exist. We didn't even do a good job in being proactive and protecting communities of color when we knew that every time we have a pandemic to this magnitude, it affects us at higher rates. The demands that we've made and what we need for our community to continue to do is to call for proper testing, proper protective equipment, more information and outreach into communities of color so folks can stay in and take this serious. And I think now that we have that and we're able to tell people this is really about life and death, your community really is affected worse. So even though we knew we didn't have the higher percentage of COVID cases like across the country in the same level of high numbers in the Black community, we know people are dying here in San Francisco that look like us and that message to be delivered. But we haven't gotten the proper response and opinion for Black communities of color and our homeless population. And we can push for that. We've written legislation, put resources in place. But you're fighting with a city department and also having to try to get the branch to move in the same way. These are frustrating battles at times.
So a question to this, Mr. Walton, is when shelter in place is lifted, because right now the data tracker, I think maybe % of the population of San Francisco tested. So if we have asymptomatic testing, we don't have a vaccine and a body thing. How will we keep the curve flat if we open up?
We won't.
There's 800,000 residents in San Francisco, and that's on the workers that come here. So protect from another surge.
You don't start to find out the magnitude of contracted the virus. One, the shelter, it's going to make us have to shelter much longer, and definitely. That's one of the points of, we have the test over 4,000 a day in Francisco, but we're only a few hundred folks every day. I don't understand why that's, I don't understand I haven't gotten one intelligence from the lead of the Department of Public Health on why we have but we're only testing a small number of folks. Those additional of tests that are available, testing the vulnerable patients that we're talking about, but it is not happening. And so if we don't test our vulnerable population who actually contracted the virus, not going to be a way to be able to stop this appropriately and vaccine. And that's all those tests need to happen by all the antibody research and the work that's being done to larger populations. By the way, I've been to get UCSF to do with the Department of Public Health, and that's tests in these communities of color and these zip codes disparity. I'm still trying to get to come on board. They have done some and they have and concerns as well, but I am also pushing to at least step up and try the testing that we're just at least codes that dim the highest level of case. So until widespread and community that have higher disparity of folks contracted the virus or have been exposed to the virus, it's going to be problematic, and we're going to be able to get out of the shelter in place.
So we have here from FMTA, and they about safe working conditions, some of the muni MPs, and about forward how they would sanitize the bus, keep people safe, and things of that nature. So I know, Kill, are you guys online?
Yes. Nicole, are you here? Nicole?
Sorry, I just had to unmute.
Okay.
So Kim, you go, I'll come up behind you.
One of my major issues as a shop steward, have to make sure that my facility is in compliance. And we had a situation, and I situation, and it became, we're going to retaliate against you, this matter up for these people back to the workplace, country, coming sick. We're supposed to have something in from HR. You need it an approval before you by your doctor. Now, the people were sick. I don't know what their status is. My question and concern is you need to let the workforce know what's going on. And if it is contaminated, we need to go into action immediately to make sure it's a safe environment for all of us.
Go ahead.
Go ahead.
So I was gonna say, contact tracing. Are you talking about contact tracing and letting people know they've come in contact with somebody so that they can protect themselves and their family?
Right. So I just want to make it clear that we need to have clear policies on this when something goes down. I've been watching all the news at the other transit agencies, and there's some things going on with whistleblowing. Now, if someone comes forward, a lot of times they try to hide the fact that something came about in this particular building, like they are in my building. And I was retaliated against, but I won't go into that. But we need to have a clear marker for all of the HR people and directors that we need to be open-minded this when something is going on as far as someone coming in the workplace that may have COVID-19. We need to make sure that it's an environment for all. And that's main.
Well, 100% agree with that. And I know one of our early on conversations with Muni, because we took a while to come up with policies to make people enter through the back. We took a while to actually provide proper protective equipment for drivers. And we took a while to put certain policies in place. And I know one of the reasons why we've actually discontinued service for certain lines was what I was told from the leadership was because we were going to make sure that people had the opportunity to quarantine, because we know some of our raiders, some of our MTA employees have either contract virus or have been exposed to it. And part of discontinuing services was to make sure that people had the time to quarantine, be safe, and not have to come. And so I know that's one of the steps that they've taken. I know we did that. I know it's not enough. I know that we still have drivers getting on buses that they feel and have not been sanitized, have not been taken care of in the manner that they should to keep people protected. So I'm having conversations with MTA leadership constantly about, one, protecting our workers. I will make sure that we have the conversation about clear protocols, what's in place, how are they informing folks of what people need to do if they're sick, what a supervisor need to do if they're sick, or if people on certain symptoms, because that should be pretty clear. And if that message is not being delivered right, I will make sure that we reach out. I will make sure I bring this to the Emergency Options Center so that directive and that information can go out to our city leadership.
And there's one other quick thing about safety. I, along with several other employees, were called out to go and clean the bus. I don't mind, but I have an underlying health condition. And so I couldn't go. And what I understand, I received some videos that these workers that were cleaning the buses were not properly protected. They can bring this home to their families. They were in their street clothes. They weren't giving coverings certain parts of their body. So we have to make sure that we're not going out here carelessly and they're getting damaged and they're coming home with COVID-19. I think there needs to be more rules and safety going forward for the people also cleaning the bus.
100% agree, and that should not be the practice, and that should not be taking place. So I will be reaching out to TA about that.
Wonderful.
Yeah. So, and I have another question too, just something to talk about is one of my biggest fears is because I know how to protect myself against patients. You know, I'm good at doing that.
Right.
But I think the biggest employees is that we're going to work with groups of people we don't mind doing, but we're all more from our workers, I would think, patients, because we protect us patients. But you know, I say co-workers see people when they to another co-worker pulling down their mask. I mean, it's very different. People have a different attitude. And so I think they need really stress to the workers themselves from management, need to have a clear message, and management needs to follow that too. Because honestly, I ain't gonna say her name. I was in a meeting with the manager and she pulled her mask off. So, you know, those kind of things are happening, and that's the way employees are going to get infected. And then us employees come in contact with patients, and those patients could get infected. That's my biggest fear, that I infect a patient. I do everything I can not to do that, but I don't see that same kind of zealous everywhere. I see it among RNs, but I don't see it among anybody else. And even our housekeepers, when they have to go and clean a COVID room, they give them these real flimsy, like jackets to put on, and it's not substantial. Now they could tell them to double, which would make them more protected, but nobody's telling people those kind of issues, and they're not being really addressed. They just say, we gave you something and that's it.
I'll say this, and I do have to get off, but one, any information or updates as the conversation continues that I need to know, please feel free to email me. I'm going to take all of your concerns that were presented here today, of course, and send this information over to the Emergency Operations Center, particularly the information about clear protocols across departments, making sure that message delivered individually and departmental, because the message is supposed to everyone wearing masks, everyone should have proper PPE, particularly in our public city departments. We all know the rules, we all know the mandate, and therefore it's our job to make sure that the proper, and so I will make sure that the EC continues to spread that message, and that we even do more to dive deeper into all smaller levels under the bureaucracy, so nobody touched in that, and we have to be more aggressive in getting that information out. But I will say that we're going to continue to push asymptomatic testing in our communities of colors, in our areas where we've seen higher number of individuals who contracted COVID-19. We are going to continue to ask for more resources to provide outreach and for more PPE for those communities that have high numbers and concentrated numbers of COVID-19. But if there's anything else we need to follow up, obviously, you know how to contact me. My office will write on it, and I'll give them clear answers and get some clear understanding from here. Any examples of folks who've reached out to OSHA and made reports, please forward me some information. So when we follow up with Cal-OSHA, we can have some documented history of understanding on our end as well.
And how many workers in San Francisco City workers have been infected with COVID, and a breakdown in race and ethnicity? Is there any report on that? How many workers in San Francisco have been infected or died from this? Is there any report on that?
I don't have any data on the number of city workers that have actually contracted the virus. That has not been data we've been given, and believe me, we've asked for it.
Well, that's an issue. People need to know. They have a right to know if city workers are being infected, how many, and the racial breakdown, the background of those workers.
So one more issue I would like you to raise with the EOC is a lot of the essential workers, we are working in workspaces less than 1 foot apart from one another. We have no social distancing. We're coming in contact with patients again who are positive for COVID because there's no contact thing, there's no record of it. So I definitely want to raise that because something I raised with Cal-OSHA. I will send you I'll send you what I have from Cal-OSHA, the report I made to them. But I think we too deserve, if we're going to be essential workers, to have social distancing in the work setting as well.
You got it. I will make sure I get on that, and I'll get you some answers this week.
Well, thank you, Supervisor Wilson, for taking your time to just today to answer these questions. It was very helpful, this information. I want to get the word out. We are going to post on a webpage along with our protests, because we are asking for universal testing, all access for all communities, because this is the only way we're going to be able to combat this disease.
Thank you so much, and I'll get some answers, and we can continue this conversation.
Okay, thank you.
Thank you.
Thank you.
Cheryl, you want to introduce George, who's our guest speaker
Kim,
today?
Yes, Kim, go ahead and introduce him.
Okay. Well, Mr. George, thank you for coming. Our questions are surrounding, as you know, the COVID in San Francisco and all over the Bay Area communities, although we know you're the president for the Tri-Valley area. Can you give us some type of feedback on what the NAACP's response is going to be around all the Black COVID items we've been discussing? And I know you work in San Francisco as well, so you have a handle on that. So if you can go ahead and tell us.
Yes. Well, thank you, Kim, and good evening to all. Good afternoon to all of you.
Good afternoon.
Thanks to all that was instrumental in planning this meeting. And again, thank you, Kim, for inviting me to participate in the conversation. And then again, thank you all you community leaders, advocates, and activists. You know, it's the greatest impact change in our community has was implemented because of small starting conversations such as this one. And so I just want to make clear that that within Solano County, there's 2 branches of the NAACP, Vallejo and Tri-City. And Tri-City advocates for Fairfield, Suisun, and Vacaville. And then we tag team to cover everything surrounding, like Napa, Benicia, and so on and so forth. But many of you may know that I grew up in District 10, and I work for Recology, as Kim stated. And there's many Solano County residents that still commute back and forth to work. We wasn't afforded to purchase a home in San Francisco. So, you know, many of us, the great exodus, many of us came to Solano, some went over to Antioch, Pittsburgh, and so on and so forth. So we're still commuting, and we still work in San Francisco. Some of those jobs in Recology, San Francisco General, Muni, and I have individuals that go to my church that work for San Francisco General and Muni that have similar concerns. One of the things that is that on the same thing, we're all saying the same thing. Concerns are real, and some of the issues I've heard from individuals I know that work in San Francisco, those church or, you know, live in the community is, again, the telecommuting concerns, protocol for San Francisco employees that may contract the disease, and how are their families being protected. So if I contract the virus from collecting garbage in San Francisco, am I going to get put up a quarantine in a hotel somewhere? You know, until, you know, I'm safe to go around my family so that I'm not infecting my loved ones. And then, you know, the other one is the PPE equipment. Now, I could say Recology has done some job giving us the, you know, the face mask and the gloves. But then again, the space, whole distancing, we can't go into the facility to change out of our uniforms and get into, or, you know, street clothes or clothes that went to our vehicles and go home. So those are some of the concerns that I have. And then with Muni, you know, one of the Muni drivers say that, there, I forget exactly, and Kim may is better than me. I forget exactly how they explained it, but while they are muni or civil servants, in an emergency pandemic, they're required to come to work and perform like emergency duties. Example, if there was a mass, individuals that contracted disease be transported, to general, transported somewhere. That's what the mandate is, and not specifically to, pick people up to take them to the grocery store. So, I may not be explaining it correctly. I don't know all the details of that rule that's in place, but those are some of the things that I'm hearing. Solano County residents that still work in San Francisco. But then we should have two conversations. The first conversation is, again, what we're talking about now, the immediate need, what we're faced with now, to make sure that our communities are getting tested. But then on the second, the second conversation should be, once the shelter place is lifted, how do we protect the community in the future? Look at our community. Why are we contracting the virus at a higher rate than the other communities? We have these food deserts in our community. We have health the health disparities in the community. All these things has there, and after this, they're going to remain here. So those are the two conversations that we should be having. The NACP, you go to our website, on our Facebook page, our president and CEO, he's been doing a series of town hall meetings with various hosts, and BET partnered with us. And so I don't know the exact meeting, the next town hall for next week, but I'll keep you all posted, and I'll send Kim that information, and she can get it out to the team. But our president, President Johnson, is one of the things that NACP do well is legislation, and we're always at Capitol Hill, and we're always advocating for our communities. And so you can hear that information directly from President Johnson on these town hall meetings. Here in Solano County, we don't have the issues that we're facing. I know we're talking about San Francisco, but some of the issues that we're facing is just individuals, that some of the complaints that in my office as the NAC president, even as individuals, Africans going to the hospital with concerns, and they're getting turned away. They're being treated, just being turned away. And then the other part of that is the testing. Testing isn't available. And then also I just posted something on my personal Facebook page. The Board of Supervisors, Solano County Board of Supervisors, are holding on to funding where we could test the homeless population and we could test the communities of need, but they're holding on to the money. And so these are things that, that are really concerned in our community, because the homeless, what do they squat at in our communities? Right. Where they feel safer in our communities than in those other communities where they know the police will be called on them, where they know they'll be harassed, but they feel safer among us, and so our communities are put at grave dangers as well, because a lot of times you see us taking them, our extra clothing, taking them food, and so you just feel they're more welcome in our communities. And so again, I'm just, I'm glad that I'm involved in this conversation. I had the luxury of being off work because of a work injury right before the shelter in place. But I'm going to be going back to work, pretty soon. And my ex-wife works for General. And so the whole telecommuting thing, she was denied it, and we're still fighting for her to be able to do it, because the work that she does, she don't need to be in that, she don't need to go to, she don't need to be in the city.
What is the NAACP stance, maybe, Jonathan, on, essential workers, because it tend to be Black and brown people and telecommuting, so that we can too be safe and shelter in place?
And so the NACP, our stand is that, we should be afforded the same opportunities that all other workers when it comes to telecommuting. One of the things, the disparity amongst the entry-level jobs or management jobs, as far as essential worker, is that a lot of African Americans are doing the type of jobs that put them on the front line. But again, when it comes to us being able to proper protective equipment that we need, and also for us to be able to just take off, to be able to take off work because of some pre-existing health conditions, or because we have, younger or elderly family members that's at home, that we don't want to put them in jeopardy. And so the NAACP is continuing to advocate on behalf of our communities. And, we want this disparity, to be eliminated. We want to be afforded the same right and opportunities of everyone else that's allowed to telecommute, everyone else that's allowed to get proper protective equipment, PPE.
So the May Day is coming up. Do you know any, like, is the NAACP participating in any of this in some of the protest area for May Day? Because I think May Day particularly, you see so many Black workers in the country, and we really need to make a stand about that. We're essential, but we too entitled to be protected.
Yeah, and so I haven't talked to the president of the San Francisco NAACP, and thank you, because you remind me I do need to give the good Reverend a call.
Yes,
and
that's my pastor.
Exactly what he's doing. But Kim told me about the May Day protests, and I'm doing all I can to make sure that I'm there. And I would encourage San Francisco NAACP to participate as well.
So I'm on the executive committee. Reverend Brown is going to participate. I was just trying to find out if other chapters what will they be doing for May Day, because this is something that we need to unite across California. I mean, we need to, our transit operators, our clerks, our people who work in the grocery stores, our healthcare workers who are, what they say, are not frontline but essential. We all really need we need all the support we can to make these companies, these city and counties, these municipals, be accountable for giving us protective gear, because really this is just coming down to dollars and cents.
Right.
And so it's capitalism.
Yes, absolutely. And so if you give me that flyer as soon as possible, I can get it out to the presidents of the Bay Area branches. But one of the things that the NAACP does, because this event is in President Amos Brown's territory, so to speak, we will be participating under his banner. And so each of us, each branch, each city, we have our own different fights. But as far as a May Day event here in Solano County, we don't have anything planned. I haven't heard Berkeley or Oakland. I'm sorry, not Berkeley. I haven't heard Oakland or Vallejo or Richmond having anything planned either. But again, if you give me that flyer, I can share that, and I can spark some conversation and spark some ideas that they can do in their respective cities.
Okay, Nicole, you guys that haven't had a chance to speak, I would like you guys to have an opportunity to ask questions.
I'm okay.
Hi.
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 Hi, Sherelle.
So one of the things, I know this is, I don't want to take too much time out, but one of the things that I kind of talked about yesterday in one of my virtual meetings is to start a small movement to do making mass movement, so that we can donate it to those agencies. And I'm wondering if there's some way that we can get more folks that are, in their homes and they have that time and capability to sort of unite on that movement, so that way that there's these additional mass and availability to create mass amounts and donate them.
Absolutely. Absolutely.
So can I say something? What I want to see is if the NAACP can help us to get the data and the numbers, because when we talk about cities, we're talking about people who was tested in San Francisco. There are many employees, like you said. I live in Antioch, that live all over the place. And that data is not being added to the numbers it should be because it's being done elsewhere. So there has to be some sort of like clearinghouse or something where all the results come in, where people can go find out that kind of data, like where's the person employed who has it, so that it can be reported somewhere.
Well, I mean, the fact that the city is not releasing the information about the city workers who have gotten contagious of COVID, and also maybe some have died that we don't even know. There was a report of Laguna Honda that workers were got the contagion.
Right.
19.
But they have a responsibility to have the figures and to present that to the city workers. They're keeping it a secret, obviously. City workers have a right to know who's getting the COVID and what's happening. If they're sick, they don't have to have their names, but they have a right to know what department and all, classification, and by race. They're keeping that secret as usual. You know, I mean,
Right.
they're keeping the secret from the membership.
Right.
Right. Everything else.
Right.
Right.
Absolutely.
One of the things that I could do in working with President Brown is to see what kind of pressure we could put on the city and the Department of Public Health to release that information. But again, I can't state it enough that I will be working under the banner of the San Francisco NACP. I won't be coming in as the Tri-City NACP in San Francisco, although I work in San Francisco.
Right. Absolutely.
I will be working with Reverend Brown under his leadership.
Okay, but even in your area, you get that data, because a lot of people in your area,
Yes.
like a lot of the people that I work with, live in your area.
Right, and then
Don't
right.
live in-
Absolutely.
So if they got tested at Kaiser and Leo, the city won't have those results.
Right, absolutely.
And then the thing is that as workers, even as city workers, when we're having possible exposures, we're not able to get testing so easily. We have to jump through rings and hoops, and you have to say you have many symptoms. And we're constantly being exposed in the workplace. And so I want to know, where does the national stand, NAACP, on universal testing for all? I mean, we shouldn't have to make it so hard. I worked in District 10. I just want to say this. And if somebody came in and said, I want COVID testing, they were sent back out. If they said, I have COVID concerns, they were brought in to see the doctor. So these semantics that they're using to use criteria to have people tested or not are just outrageous. So I want to know what we can do, please, so we can stop this. We can spread the word in our community, and we can get our people in the community, the people who are marginalized the most, testing. We need widespread testing to combat this disease.
Yeah, I can find that information out and share it with you. Again, I haven't heard in the town hall, the series of town hall meetings that President Johnson has put on so far. I hadn't heard that come up, but they do want the presidents of each branch to submit questions or concerns in their local areas so that they can address during the town hall, and that's definitely something that I will put, I will bring up.
So maybe Black workers, we should send, or these different organizations, we should be sending questions like this to directing it to you, so you can send over to the national, because I mean, actually, we need as much support as we can, because as Supervisor Walton cited early on the call, Kim and I and Brenda, Ingrid work for the Department of Public Health, and they're the ones that put all these policies out, and we're just, I mean, as Black workers, we're not protected at all, and we need help. We need some help. We're calling for a national call. We're tired of the discrimination that we're facing, the retaliation, fighting for our rights just to work, fighting for our rights just to work in a safe, and so we need to be safe. So I'm sorry, I got on my soapbox.
You don't have to be sorry about
Don't
that.
apologize.
Human rights, I mean, everybody deserves human rights. Everybody deserves a safe and healthy safety place to work. And that's a human right, basic human right. And unless you have safety, you shouldn't be forced to work. I mean, if workers are afraid, they're basically blood money. They're being terrorized to go to work, even if they're sick. This is what's happening. People are being forced to work even when they're sick, and that's a crime, really. So I think we, at the rally on Friday, May Day, we need to have a list of demands that we present to the media, specific demands about what's been happening. People have been retaliated against for speaking up for health and safety. We need to have accountability of those managers. They have to be held accountable.
Exactly.
Right. Well, they
Exactly.
need to be held. I listen. If they break the law, I feel that they have to be held accountable legally. And when I say legally, if you break the law, I mean, you go to jail like anybody else. If you are shown to be negligent, I mean, some of this is murder, is what's happening. When you put people out here in harm's way knowingly, and you have no exposure plan and no way to do contact tracing, I am sorry, this is murder, and people have to be held accountable. We have standards that are in place by Cal-OSHA. So I know this call went on really a long time. I really wanted to talk about technology, especially around the MTA and transit, and about the things that they're doing in China and places like that. But I know the calls has gone on, and so I don't want to take people's time too much. But if anybody had anything that they wanted to say about that, because the reason I keep raising the transit system is we have 800 residents in San Francisco, and I think about 500,000 or 600,000 people that come here to work, and they use MTA. And so if we don't find a way to sanitize those buses quickly, we're going to continue to see the curve of COVID rise. So I just wanted anybody who had anything that worked in MTA, is there any technology that they have in the works to try to sanitize the buses to protect the workers and the public?
So far, no.
No.
What they have are high, you know, the high, what do you call it? The sprayer, the high, not frequency, but high, Kim, help me.
Power.
It's like a sprayer. I have some videos
Yeah.
too, by the way.
Yeah, so they have those,
Yeah.
and they have hazmat suits for some,
Not all.
but you have to remember how many barns we have in MTA, and not all of the barns have the same cleaning equipment. They should, but they don't. And then they're trying to get a lot of people to volunteer to clean the buses, because even though Evelyn Curiel, who is the shop steward and I think president or vice president for the car cleaners, has been begging for 2 solid years, when Ed Riskin was in office and now that Jeffrey's in office, to get more car cleaners. They had open requisitions that were never filled. They had budgeted positions that were never filled. So as for technology, no, there's no technology that's going to beat good old soap and water.
Right.
But they don't have enough people for the amount of buses still on the road, because either these people are afraid and are self-quarantining, or they have been injured, because they had a lot of people that were on the injured list, or have contracted, or they are immunosuppressed. So the problem becomes, how do you get enough people to clean the bus? Well, you send out DW assignments. But the problem with that, other people that they're sending to that are immunized.
Right.
And if they're compromised and they bring it to their family, what's going to happen to that family? It gets wiped out. If they survive, maybe not all of them do. So no, there's no technology. It's good old sprayers and elbow grease. They just don't have enough people.
So, Nicole, I just maybe for you, I don't know, guys, how you feel, but if you want to join us in support of our demands about unsafe working conditions, we're having a May Day protest. But I want to also add about technology in our demands. In China, I have an article that they're using ultraviolet ray, those lights, to zap the coronavirus and kill it. so that they can turn their buses around quick. I think these are the kind of things. We live in San Francisco, one of the most technological rich areas of the world. So I don't understand why we're so behind in technology. Right. And those sprayers are one thing. We can have ultraviolet lights as well to kill the virus.
And they have supplies for their workers in China. The bus workers, the frontline workers are all protected. They have all kinds of masks, all kinds of protection. Are they telling us with the wealth that we have in San Francisco, they can't get protection for the workers here, but they have it in China? I mean, this is really outrage.
Yeah.
I mean, really. You've got 17 billionaires in San Francisco.
Kim and I,
and you can't even get protection for the frontline workers. I mean, it's criminal, really.
Exactly.
So Kim and I were on LMC with Jeff Tumlin. What, a week ago, Kim?
That's a week ago.
Yeah. So we had the discussion with him about protecting our workers, cleaning the buses, about making sure that the buses that are still in service are getting the priority to be cleaned, but also cleaning those buses that they have taken out of service. Because if they clean those buses, close them and lock them, when they do go back into service, no one gets sick. But everyone is being reactionary. No one is thinking ahead. No one is planning at the future. They're just thinking about yesterday. Right. They haven't even caught up to today yet. They're still planning for yesterday, which means that this curve, if the city does open up on May 4th, this curve is going to increase because the buses have not been, they need to be sanitized and disinfected. They haven't done that with the entire fleet.
No.
They're still being reactionary. And until that time, the city can tell us anything they want to, but the truth of the matter is they don't have enough people to clean them, and this curve is going to increase.
Wow. Wow.
There may need to be we may need to make a suggestion. Maybe they need to contract out, you know what I'm saying? And have some professionals come in. Because from the videos that were sent to me, how clean the buses, it's bizarre. It's bizarre. And it should not be. These people are coming in there street clothes on.
Yeah,
and not properly covered. Some people had shorts on with their legs out. They didn't have the extra suit over them. So I think there needs suggestion to them.
Well, before
I understand.
So to be clear, oh, sorry, 1 second. To be clear, we have environmental service people in the city and county. We have experts on cleaning and disinfecting for materials, hazardous waste, and I'm talking about just in the hospitals. Around the city and county and the school district, we have those experts. They're not utilizing them because one, they're SEIU members, so let's just retaliate against one of the biggest unions in the city. And two, instead of using the expertise we have, they're contracting out to their friend's company, to someone they know, to anyone else but city workers, because once again, this goes back to that age-old problem of privatizing city work.
Absolutely. And that's why,
sorry, Cheryl.
Nicole, I want to echo that. And I wanted to say, they have, I mean, why are positions unfilled? I mean, these buses should have been cleaned anyway. That should just be the standard, the normal standard. So I agree with you about that.
So do we have a list of demands, or is it a running list, or when can we get?
So Kim, do you want to, we do have a list of demands we can post. We have a website. Kim, do you want to go ahead and tell them about the website?
Yes, please, yes. We do have a list of demands on our website, and we're refining it every day. So if you guys have some other suggestions, please let us know. So our website address is black Workers Unite, which is UNITE.com. And we have the list of demands there, which is kind of lengthy. We are refining it as we go day by day, and we're hearing of more actions that we need to address.
And Kim, can you also talk about people can send their stories there, you know?
Oh, yeah.
We want a timeline
Yeah,
where people
excellent.
have.
Mhm. So what we're doing now is we're trying to get stories. So you or a coworker, someone you know has a story that they would like to share, please have them get in contact with us. We do have a contact information link there, and we would love to videotape their story and have it on our website.
Great.
Because we want the public to see what's really going on.
Really
And we
going
like
on, that's right.
media involved with this.
And if they can't be there on Friday on May Day, they can still get their story out. They're not
Correct.
gonna be there on Friday on May.
Kim has the flyer for the rally on the protest, the car caravan on Friday, May Day. We're really asking people to support this effort because, again, we want to draw attention to these inequities. Any other events that we can support or any other events like this coming up, please contact us. We can put it on our website. We're here just to spread the word.